Hello and welcome to the International Society of Cannabis Pharmacists, Cannabis Considerations in Pediatrics. Now this is just a 2-minute teaser, but rest assured we are offering this 2-hour ACPE accredited education to our members for free. So have a listen, and then if you haven't signed up already, visit our website at cannabispharmacist.org.
What we now know from the endocannabinoid system is that there's a retrograde inhibitory signal that travels across the synaptic cleft to inhibit further release of neurotransmitters. And depending on what, specific disease state we're talking about, depends on what neurotransmitters effects we think we're seeing. Acetylcholine, norepinephrine, dopamine. When we think about dopamine, too much dopamine signaling, you can have psychosis, schizophrenia. Not enough, you get Parkinson's-like symptoms. But there's so many other applications for that. Most times when people think cannabis, they think inhalation. And I just want to draw your attention to the graph here. So this is time in minutes along the axis. And then this is the concentration in the blood. So when smoking products, you smoke and you inhale, and you get this rapid peak of THC. So this is peaking by 10 minutes. And then it'll taper off. The duration of activity after smoking is about 2 to 4 hours, but there's a lot of variability due to inhalation.
So my aim overall is to provide an evidence-based overview of rigorous research looking at the links between cannabis cognitive functioning and mental health in youth. And what we really want to get at is, does cannabis cause cognitive brain or mental health changes? But this is exceptionally difficult with observational research. And that's really where we are as a field right now. There have been very few randomized controlled studies, which are really kind of our top level of evidence that we have to look at causal effects of cannabis. We really just have associational studies in individuals who have chosen to use cannabis recreationally at this point. There's not even that many studies looking at this with medical formulations or other forms of cannabis. We published on this last year, and this is the same cohort from Philadelphia I mentioned before, but here we're looking at neuroimaging, so you can't easily scan 10,000 individuals. So this is around 800 individuals. So we have around 40 frequent cannabis users, around 100 occasional cannabis users, and around 400 or 500 non-users. And you don't really need to do any statistical analyses to look at this and say that there's not much differences across groups. So basically, this is looking at brain volumes. Over here on the left, we have total brain volume. We have gray matter of the brain, that volume, and then we have white matter of the brain.
With any cannabinoid, especially our major cannabinoids, the biggest challenge, which makes cannabis medicine more of an art than a science, is this biphasic effect. So at low doses, THC can be anxiolytic, and then at high doses, it can be anxiogenic. And so we don't know what each personal dose might be, and that's why we have to use such judicious dosing mechanisms. But it can also have paradoxical reactions. And a great example of this would be like Benadryl or diphenhydramine. So usually it's sedating, and then in kids, it's activating. So we can see that same paradoxical effect with THC or CBD, especially in our pediatric patients. These mental health side effects are almost entirely related to inhaled cannabis, the most common method, especially among youth, I agree. Do you think it's possible that the association could be with dosage form? As we know that smoking high THC spikes THC concentration. Do you think it's full spectrum, or enteral administration would remove this association?
To find out the answer to that question and more, visit our website at cannabispharmacist.org.